Senator Sanders.
Thank you very much, Mr. Chairman, and let me thank all of our panelists for being here and for the great work that they are doing on this pandemic. Let me ask a question that has just bothered me lately. All of you, and I think most Americans, understand how important social distancing is. We're told over and over again, the chairman told us at the beginning of this meeting, stay apart, at least 6 feet apart if you can. And just the other day, however, American Airlines announced that they were going to fill up all of their planes. And other airlines have done the same. So you're going to have people going from New York to California, 5-6 hours, sitting inches apart from each other. And then you got buses all over America where people are kind of packed in like sardines. My question is, why hasn't the government, whether it's the CDC or the Department of Transportation, issued guidelines prohibiting those violations of what we all know to be common sense? Who wants to, Dr. Fauci, you want to start on that one there?
Thank you, Senator. Well, I'm not the CDC, but I'd be happy to make a comment on that, and maybe Bob would also. I mean, obviously, that is something that is of concern. I'm not sure exactly what went into that decision making. I would hope there would be something to mitigate against that, because I know, as we've said, and I continue to repeat it, that avoiding crowds, staying distance, and when in a situation like that, wear a mask. I think in the confines of an airplane, that becomes even more problematic.
But generally, I understand the mask thing, but doesn't it sound a little bit silly and a little bit in violation of everything you guys have been talking about? To have people sitting next to each other for 5 or 6 hours in an airplane or crowded into a bus. And my question is, why hasn't, the president issues a lot of executive orders. Why haven't we stopped that type of activity and told the airlines and bus companies that is unhealthy?
Senator, I appreciate your question, and I think it's a critical area. I can tell you that when they announced that the other day, obviously there was substantial disappointment with American Airlines. A number of the airlines had decided to keep the middle seat thing. I can't say this is under critical review right now by us at CDC. We don't think it's the right message, as you pointed out. Again, we think it's really important in individuals that are in, whether it's a bus or a train or a plane, or social distancing to the degree that's feasible, and at least have a reliable face covering. So,
okay. Well, I thank you, and I just hope very much that the CDC or the appropriate agency basically tells these companies that that is unacceptable behavior. They're endangering the lives of the American people. Let me go to another question. I just have a few more questions, and not a lot of time, so I'd appreciate brief answers. At the University of Washington, the Institute of Health there indicated that if 95% of the American people were to wear masks, we could save some 30,000 lives. A number of countries, including South Korea, France, Turkey, and Austria, have provided low-cost or free masks to all of their people, something that I believe in. Would you support an effort to greatly increase the production of high-quality masks in this country and distribute them free of charge to every household in America? Dr.
Yes.
Fauci or anybody else wants to jump in on that?
Yes, of course. I think masks are extremely important, and we keep hammering home. And I think what you just mentioned is as important. There's no doubt that wearing masks protects you and gets you to be protected. So it's people protecting each other. Anything that furthers the use of masks, whether it's giving out free masks or any other mechanism, I am thoroughly in favor of.
And I just want to echo that, Senator. In my opening statement, I called on an environment that we have universal masks. I think it's fundamentally the most important thing we can do.
That's great. But when you refer to quote-unquote universal masks, which I agree with you on, would you be supporting the increased production of high-quality masks and basically distributing free of charge to every household in America? Because I think that's going to save tens of thousands of lives. Would you agree?
So Senator Sanders, this is Brett Giroir. Yes, sir, I agree that is very important because we need to support mask wearing. I would also point out that Dr. Cadillac, the ASPR, has contracted for hundreds of millions of cloth face coverings that could be distributed around the country, and those kinds of processes are being thought of. When I'm not in uniform, I wear them. They're white. They work very effective, and I think they're a great investment for the American people.
Good, thank you. My very last question, it's an issue I've raised now for the last couple of months. All of us hope to God that a good, safe vaccine will be developed as soon as possible. But that vaccine may not mean anything to a low-income person who might not be able to afford it. I happen to believe that we should make these vaccines. And by the way, as you all know, federal government, our tax dollars are going to the tune of billions of dollars into drug companies to help develop this vaccine. That's okay. But would you agree with me that after that kind of investment, we should make sure that every American, every person in this country can get a vaccine regardless of their income?
Yes.
Okay, anybody else want to comment on that?
Yes, Senator.
Yes,
Agreed.
Senator.
Yes, Senator.
Well, good. Thank you all very much.
Thank you, Senator Sanders.